Hi students, I am Dr. Badrinath working as a professor. This video is for coagulants. See the above picture, all the RBCs are separate and blood is flowing very smoothly. Whereas these coagulants, they make all the RBCs and blood to clot together. See the below picture, blood clot. See all the RBCs are together because see here you can find a thread-like structure. It is called a fibrinogen. All these are acts like a thread and it ties all the RBCs, platelets together. So coagulants are the substances which makes the blood to clot, to plug together, to clot together, to tie together is called as a coagulants. Reverse, anticoagulants, ulta palta, anticoagulants. See here, blood clot is there. It will be dissolved to a separate RBC, separate platelets by the anticoagulants. Anticoagulants are the substances which breaks the clot, which dissolves the clot, is called as anticoagulants. In this video, we will concentrate the coagulants only. Next video, I will do on anticoagulants. Okay, coagulants. That is today's topic in this video. Okay, watch carefully. Bye. This is your unit 2 syllabus as per your university syllabus. Unit number 2, pharmacology of drugs acting on cardiovascular system. In this topic, I have already completed drugs used in the therapy of shock in my last video. Hematinics also I have covered. Okay, and coagulants. That's why I highlighted with the reading. Today's topic in this video is coagulants. Next video, anticoagulants. Coagulants are also called as synonyms. Other name. These are the very important because in the exam they will not give you direct question. Indirectly they will give. Just they will give you as a classify the blood thickers. So even though you know the coagulant, you are unable to write about the blood thickers because you don't know coagulant is also called as a blood thickers. Keep in your mind, blood thickers. Blood becomes thicker, very thick. And hemostatic agents. This is an important bit in competitive exams. What is meaning of hemostasis? Hemostasis is a prevention of blood loss. Is called as a hemostasis. Prevention of blood loss. And substances. Coagulants are also called as substances. Accelerates the coagulation. Accelerate. See my hand movement. Accelerate. It fasts. Accelerates the coagulation. And also substances which increases, see the hand, which increases the coagulation. Substances which make it a quick clotting time, very quickly clots. And thrombo aggregates, all thrombocytes are aggregate together, aggregation, thrombocytes, and also called as a platelet aggregators, platelets. And also called as a blood fusers, RBC fusers. All RBC will be fused together, blood fuser. That is also like that. They will call in other name, just like a god having several names. Coagulants also having several names. The same, any name, same meaning. Keep in your mind, almost same. Yeah. Here, this picture, you have to draw in the examination. Yeah, this is very important for regular examination and also competitive examination. See here, all the RBCs came here and also platelets. See here, small platelets are there. Platelets are very smaller in size when compared to the RBC. Keep in your mind. So, and it is also color is different. Since it is RBC, it is a red color and this is a white color. Okay. Broken blood vessel. See here in the broken wall, blood vessel wall is broken. So immediately what happened? All the RBCs along with the platelets comes together. It comes. See how it starts accumulation because there was a damage to the blood vessel. So what happened after accumulation? platelets become activated. This point is very important. Platelets become activated. That's why here I highlighted platelet is a key. Key. Platelet is a very important key for the formation of clots. These clots make a biggest problem that we will see now. Okay. See here, activated platelet, clot, fibrin. Fibrin. See here, the thread-like structure I have told now, this is called a fibrin. Clot, this entire step is called as RBC. Activated platelet or white color. Okay, this diagram you must write in the examination, and points also you have to describe. Coagulants. Now you come to the definition of coagulant. Hemostasis means arrest of blood loss, prevention of blood loss. This we can call it as a coagulant. And blood coagulation involve complex interaction between the injured vessel wall, platelets, coagulation factor. It is very complex in nature. It is not easy. There is nearly 13 factors are there to clot the blood. It is very complex interaction between the injured vessel wall, platelets, and coagulation factors. Keep in your mind, 13 coagulation factors are there. Now, you come to the classification of coagulant. All this made the blood to clot. Because in case of any emergency of hemorrhage, like external hemorrhage during an accident, okay, all the blood vessels are ruptured, immediately blood coagulation is emergency. If blood must have coagulation property. If blood doesn't have coagulation property, blood will be lost. Keep it in your mind. That is very important. One of the important characteristic of the blood is blood must have coagulation property. See here, list of coagulants. First is a vitamin K, king. Vitamin K, it is a very king. Fibrinogen, just now we saw fibrin structure, thread-like structure, fibrin, just like a thread, tie. Fibrinogen, it is also belongs to human fibrinogen only. And anti-haemophilic factor, despressin, press in, desk, you can keep in your desk, press in. Adrenochrome monosemicarbazone, rutin, ethamsylate, it is very important. Ethamsylate is very important. Rutin is important. Desmopressin is important. Vitamin K is important. Remaining are not much important. Okay. For competitive exams, you have to note all these things. For regular exams, 4 are enough. What I have told. Vitamin K. We will start with the vitamin K. King. K stands for king. Okay, it's a very good coagulant. Okay, it is very essential for body also. During in case of any external hemorrhage or internal hemorrhage, external bleeding or internal bleeding inside the body itself, sometimes internal bleeding will happen. Very dangerous situation. Vitamin K is essential for the blood clotting. Vitamin K is a fat soluble dietary principle. You know that vitamins are two types: water soluble, fat soluble, ADEK, fat soluble, ADEK, K came here. Vitamin K is a fat soluble dietary principle required for the synthesis of clotting factors. All the clotting factors requires vitamin K. Otherwise, there is no clotting, there is no vitamin K, no clotting factors. No clotting factors, no clotting. Daily requirement, vitamin K2 produced by the colonic bacteria, intestinal bacteria, and 3 to 10 micrograms per day external source. That is also needed. Maybe sufficient. 3 to 10. Keep in your mind, that is important. 3 to 10 microgram external dose. Either through a tablet or through a dietary or through a vegetables, whatever it may be. Total requirement of vitamin K for an adult has been estimated as a 50 to 100. Very easy to remember. Round figure. 50 is round. Half century is century. Micrograms, not milligram. In the exam, they will give confusion. Microgram, milligram. Okay, like that they will give you. See, these are the sources of vitamin K. Mainly keep in your mind cabbage. See pronunciation K, cabbage. Easily you can remember. And it is a very richest. Cabbage is very richest with vitamin K. You take regularly, go to vegetable market, take the K regularly, but not extra. If you taking extra of vitamin K, inside the itself blood clotting will start. So blood will not flow in the body. That is very dangerous also. So vitamin K you have to take, but in a limited dose only. Cucumber, K, same pronunciation. K, cucumber, K, cabbage, like that. K, cali, K-A-L-E, cali. These three are very important. First one is cabbage. And since it is a fat soluble vitamin, you can find it in the liver. See here, liver. And also soya beans are very important. And see the oil also. Vitamin K is water, oil soluble, no fat soluble. Liver and also olive oil. Like that you can keep in your mind. And also egg yolk. That is also fat. See here fat, egg yolk. It is also fat soluble. So like that you can remember 3 oils, 3 Ks. Okay. Yeah, this is very important. Available forms. See, vitamin K is available in 3 forms. The 3 forms were appeared in number of question paper. Number of question paper like drug inspector, RR, railway recruitment board pharmacist, in hospital pharmacist, okay, in all entrance examination, including NEET also. Number of times it was appeared. Available forms of K. K is available in 3 forms. 3 forms. First one is vitamin K, K1. Vitamin K1, other name is called as a phylloquinone. This is also very important. What is the other name of K1? K1 is a phylloquinone. It is also called as green leafy vegetable. It is only vegetarians. K1 obtained from only vegetables. Only vegetables will give the K1. It is a phylloquinone. See here, phylloquinone. How to remember here? You can see the pahalman. Pahalman, phylloquinone. Phyllo. See here, pahalman. Like that you can remember. Okay, and this Pahalman is taking his K1 and he is taking only the leafy vegetables. See here, green leafy vegetables he is taking. That's why his body is strength and he become a Pahalman because of the K1. Next is vitamin K2. K2 is also called as a menaquinone. Menaquinone. Meena. See here, keep she is a actress, Meena. Meena quinone. Queen, you can keep in your mind. Meena is a queen. Produced by the bacteria in the unfermented food. Like in our intestinal, bacteria will be produced as the menaquinone. In the exam, definitely they will ask which type of vitamin K is produced by the bacteria. K1, K2, K3, K4. What is the other name of K2 vitamin? Menaquinone, menaquine. Vitamin K3, menadione, done, menadone. Like that you can keep note. Vitamin K3, same name, D-I-O-N-E, 1, done you can remember, or MENA 1 you can remember, okay. And this is a synthetic form, synthetic K3 is a synthetic. So first one is Pahalmon, second, and it is a purely vegetarian. Second one is only bacteria or bacteria, and third one is synthetic, which we will prepare only in the laboratory. These 3 forms, synonyms. What is the other names? It is very important. Fermented K. What is a fermented K? See, vitamin K2 is a fermented form. And I told no, Desmopressin is very important. Desmopressin, desmopressin. This is also one of the very important coagulants. In case of emergencies and all, these drugs they will inject directly to avoid the blood loss for the haemostasis purpose. Desmopressin, you can see the tablet here. Desmopressin acetate form is available in the form of tablets. mg is 0.2 mg, very less dose. If you are giving a high dose, no, what happened? No, Inside the blood itself, it starts clotting. There is no flow of internal circulation of the blood in the body. It leads to a very dangerous condition. Desmopressin, DDAVP, stimulates the release of Wille-Brand factor. Keep in your mind this Wille-Brand factor. That's it. The remaining and all not much important. Okay, only keep in your mind. Okay, Wille-Brand factor, Desmopressin tablets 0.2 mg. It's more than enough to write in the exams. And see here, coagulants, cryoprecipitate. Precipitate, it forms a precipitate. Their name itself indicates precipitate. Cryo means a cold. So if you chill now, automatically all this blood start clotting. Just you have to reduce the temperature. That's why it is called a cryo. Cryo means not cry, not cry. CRY cry, not. This is cryo. Cooling. Cryoprecipitate is a plasma protein. This is a plasma protein that reduces the blood temperature and immediately it makes the clotting of it. That is just one point, keep in mind. Cryoprecipitate is a plasma protein. Okay, it clots the blood by reducing the temperature of the blood. That's enough. And see here, total that completes the coagulants. Only the slides what I have shown, this is more than enough. Vitamin K, K sources, available forms and synonyms, and coagulants, desmopressin and cryoprecipitate. That's completed. Now we will see the mechanism of blood clotting. Clotting factors are 13 factors are there. It is very complex in nature. It is not easy. Clotting is not easy. Clotting 13 factors are required, 1, 3. And in that only there is no sixth factor. Keep in your mind. Which factor is not there? In the exam definitely they will ask. Sixth factor, no 6. Okay. And these factor names are very important in all competitive examinations. Keep in your mind. Definitely there will be one question from this. You have to practice. Factor 1, Fibrinogen. F, first. See here factor 1, since it is a 1, first. So F stands for first. Fibrinogen, F5, fibrinogen. Factor 2, prothrombin. Pro means before. So that you can keep in your mind it is a 2, prothrombin. 3, tissue thromboplastin. 4, calcium ions. 4. It is very easy. 4 is calcium. 5th is labile factor. 6th is stable factor. You can keep a labile, stable. Okay, labile means 5, stable means 7. There is no 6th. Anti-haemophilic factor, that is also we have saw in coagulants. These names they will ask in the exam. What is the other name of factor 8? Factor 8 is called as an anti-haemophilic factor. What is the name of factor 7? Stable factor. What is the name of 6th factor? There is no 6th factor. And see here, anti-haemophilic. Next is 9, Christmas factor. Christmas. Easy, remember, festival. It's a very famous festival. Plasmothrombo. What is the other name of Christmas factor? Plasmothromboplastine component, PTC. And 10, Stuart power. Daska power, Daska dam. Keep in your mind. Power. Stuart power factor. Daska dam. And factor number 11, plasma thromboplastin antecedent. And this is a 11. 12 is Hageman's factor. Hageman, H-A-G-E, Hageman factor. And fibrin stabilizing factor. These are the 13, total 13 factors. No factor 6. Don't change the number, don't change the order. Yeah, here this is, you can see the blood clotting is not easy. There is a 2 pathways are there. 13 factors are involved. 2 pathways are involved. One is intrinsic pathway. See here, intrinsic pathway. Here you can see extrinsic pathway. I have shown a different color. And here you can see the common pathway. This is a common, just like a common highway. See here, this is a common. That's why it's a very broad. See here, very narrow. This is narrow width. See here, the width is big. That's why I mentioned here a very big way. This is a highway. So this intrinsic pathway will come and meet in common pathway. Extrinsic pathway will also come and meet in a common pathway. Common pathway is nothing but a highway. The remaining two are the sideways, just like a Y junction. Y junction. And see here, extrinsic pathway is very short. See here, only few steps are here. You can see now. See that here. See how many steps are there. Keep in your mind, in the exam they will ask in the competitive exam which pathway is having a highest steps. Intrinsic pathway is having a highest steps. Extrinsic pathway is the shortest. Only few steps are there. Keep in your mind. Steps are few. Here steps are more. Intrinsic. And the remaining is common. So where is the common pathway starts? Prothrombin converted into thrombin. Fibrinogen converted into fibrin. This is the main important thing. It is only the thread. The thread we are using to tie the RBC. RBC. All RBC cells we can be tied. Cross-linked. See here, cross-linked fibrin clot will be formed. Right? Now we will see what is the difference between an intrinsic pathway and what is the difference between extrinsic pathway. We will see it in. Keep in your mind, this is the shortest route. Extrinsic is a shortest route. Okay? It appeared in old question paper. Yeah, in this slide, I have shown the two columns. One is green color and another one is a blue color. Green color is an intrinsic pathway and extrinsic pathway is a blue color. See here, intrinsic pathway refers to a multiple cascade of protein interactions activated by a trauma inside blood vessels. Here, see same thing, damaged external surfaces here inside the blood vessels. That is the key difference between the extrinsic and intrinsic pathway. Very easy to remember. Extrinsic pathway means external surface, damaged external surface. Intrinsic is inside the blood vessel. See, intrinsic inside, extrinsic external. And activated by the internal trauma. Here, activated by the external trauma. That is, and various factors. These are the factors involved. Many factors are. Which pathway is involved? Many factors. Intrinsic factor. Here, only factor 7 is involved. See, here it is a fast. I have already shown you know this is a very fast, shortest and fastest route. Very fast. This is also appeared in old question paper. Why means only takes about 2 to 6 minutes for the initiation of blood. In case of emergency and all, in case of accidents, only extrinsic pathway will work. In case of any accident, all road accidents, blood loss, immediately there must be a blood clot. All those are initiated by extrinsic pathway only. Shortest route, fastest route. Only 2 to 3 minutes are sufficient for the initiation of blood clot. Here, see here it takes nearly 15 to 20 seconds for the initiation of blood clotting. Only for the initiation, not for the complete clotting. That is a very important point. Initiation of blood clotting. And see here, it requires the both calcium and tissue factor. This is also one of the important bit, tissue factors. Because since it is outside the blood vessel, no, it requires some tissues factor from the tissue. And here it requires the ionized calcium. Right? Yeah. And here I have my slide. In the next video, I will show you what is an anticoagulant. So I will stop here and repeat and rewind the video if you have any doubt. And thank you and bye-bye.